Hello and welcome to Alcohol and Wernicke's encephalopathy, a public health perspective. I'm Dr. Gargi Sinha. In the slides, I will quickly cover the introduction, the clinical features, a little bit of differential diagnosis, and the treatment plan. So what is Wernicke's encephalopathy? Wernicke's encephalopathy is an acute neuropsychiatric syndrome resulting from thiamine deficiency. Carl Wernicke first described it in 1881. Thiamine in its biological active form, thiamine pyrophosphate, is an essential coenzyme in several biochemical pathways, particularly in carbohydrate metabolism. Thiamine deficiency appears to precipitate hemorrhagic lesion in some region of brain, including mammillary bodies. The condition can arise in many clinical settings, including chronic alcohol abuse, malnutrition, gastrointestinal surgical procedure, recurrent vomiting, chronic diarrhea, chemotherapy, malnutrition, and starvation. So, what are the social factors associated with Wernicke's encephalopathy? Although, from the medical viewpoint, Wernicke's encephalopathy is associated with chronic alcohol abuse. It is said that the absorption and the utilization of thiamine decreases in a chronic alcohol abuses. However, there's a complex interplay of factors associated with alcohol, which leads to the deficiency of thiamine. These factors can be very complex, and if you look deeply, in case of alcohol dependence, there is a tendency that a person stays at home, and this can lead to unemployment. And as you know, unemployment can lead to poverty. And many a times, it is evident in alcohol user's life that they are isolated because of a constant argument with the partner and family. In case of alcohol dependence, there is a tendency of skipping nutritious meal. For instance, instead of a regular dinner, a person may prefer drinking alcohol. As a result, one may feel a sense of having enough food without even having any meal. Hence, on a regular basis, skipping lunch or dinner can cause thiamine deficiency. And with our medical viewpoint, we know that the thiamine deficiency causes Wernicke's encephalopathy. Now, moving to the famous triad of Wernicke's encephalopathy, it is said that there is ocular abnormalities, confusion, and there is ataxia. So, ocular abnormalities means the problem with the eyes, and they can be nystagmus and ophthalmoplegia. Confusion can come up with the sign of delirium, and ataxia is the gait abnormalities. Now, how to diagnose Wernicke's encephalopathy? Diagnosis is clinical, based on history and the presence of above described symptoms in a setting of alcoholism or suspected thiamine deficiency. The diagnostic workup is as for any case of delirium. So screen for infectious disease, requests can be sent for lumbar puncture. Tests are usually negative and are used to rule out various differential diagnoses of delirium. Among investigation, MRI scans are likely to be more predictive. Now, the differential diagnosis. I'll just talk about two differential diagnoses: alcohol withdrawal delirium and temporal lobe epilepsy. Treatment plan. One thing to remember, this Wernicke's encephalopathy is a medical emergency. The mainstay of treatment is parenteral thiamine. Thiamine treatment is necessary to prevent progression to Korsakoff syndrome or even death. Oral thiamine is generally of no benefit. Thiamine should be given early as soon as the condition is suspected. Now, how much thiamine we should give? So there is no consensus. However, it is recommended that 500 milligram of thiamine hydrochloride in 100 ml of normal saline. It is important to note that thiamine should be given before carbohydrate. And why it is important? If you don't give thiamine then before carbohydrate, then it can precipitate tissue damage. Moving on the preventive strategies, I try to divide the strategies into individual level and population level. Individual level, you can encourage alcoholic not to skip meals and have a proper meals. The meals which are, or the food which are rich in thiamine, such as legume and vegetable, we can recommend that for the alcohol user. On population level, providing thiamine supplement for alcoholics can be one solution. Or we can think about awareness about thiamine deficiency and alcohol use for the general public. In many countries, there are national policies for fortification of flour and bread. However, still many developing countries don't have these uh, policies. So we can think about these prevention strategies. Overall, in summary, the clinical feature is very important. These are ocular abnormalities, confusional state, and ataxia. And in treatment summary, one must know that this is a medical emergency and to not give carbohydrate before thiamine and give parenteral thiamine. Hope this would help you to understand the social factors linked with Wernicke's encephalopathy and thiamine deficiency for a chronic alcohol user. Thank you very much for listening.